Hey guys, so in today's video, I thought that I would share some of the symptoms of hypoglycemia and talk about the symptoms that I have. For those of you who have been following my channel for a while, you know that I use a Dexcom continuous glucose monitor. I use the G7, and the reason why I use the G7 is because I don't always get symptoms of my hypoglycemia, but in today's video, like I said, I thought that I would go over some of the most common or more common mild to moderate to severe symptoms that a person can get from hypoglycemia and kind of tell you guys which ones that I experience. So when I do experience symptoms, I should say that. So if you see me looking down, it is because I do have my phone and I have a list of the most common symptoms. There may be other symptoms that a person experiences of hypoglycemia. These are just some of the more common ones. And like I said, I am going to go through them and tell you if this is something that I have when I experience low blood sugar. Like I said, I do use the Dexcom G7 continuous glucose monitor just because I don't always get symptoms, but I'm going to go over the ones that I do have occasionally. So in the mild to moderate symptoms, shakiness or trembling. So sometimes I get this, especially when my blood sugar goes down into like the 50s and 40s. Occasionally I have dropped into the 30s, but usually when I'm that low, I don't always have symptoms. Occasionally I get shakiness or trembling, although sometimes I get that just because I have a seizure disorder. I have epilepsy as well. So sometimes it happens before I have a seizure, sometimes it just happens, and other times it happens when I get hypoglycemia. So I don't always rely on that as a sign that my blood sugar is low. Sweating, I don't get that. Hunger, I don't get that either. Dizziness or lightheadedness, I do get that occasionally. Sometimes I get that though when I'm not low, so I don't always use that as an indicator of low blood sugar either. Usually if I get like extreme dizziness or lightheadedness where I feel like I'm going to pass out, I check my blood sugar because like sometimes even if the Dexcom isn't saying that I have low blood sugar, sometimes my blood sugar is low with a finger stick, so I do like to check and just make sure that it is correct. Let me see. Palpitations or a fast heartbeat, sometimes I do have that as a sign or symptom of low blood sugar, and sometimes it's not low. So like I said, my symptoms are kind of weird and it's not always accurate for a low blood sugar indicator. Anxiety or nervousness. I'm a person who has an anxiety disorder to begin with, so I'm always freaking out. So I can't rely on that as, an honest indication that my blood sugar is low just because I have an anxiety disorder to begin with. So like I said, I can't always rely on being anxious or feeling nervous as an indicator of low blood sugar. Irritability or mood changes. I do get that occasionally when my blood sugar drops below 50. So sometimes that can be an indicator. It's usually more confusion, which that is a possible severe symptom of hypoglycemia. So usually when my mood changes, sometimes I'll get irritable, but most of the time it's more confusion related. Weakness or fatigue, again, I take so many medications to handle or control my epilepsy that I'm always tired. So that can't really be a strong indicator of hypoglycemia for me. Blurred vision, I have had that before as a sign or symptom of low blood sugar. However, if it's peripheral vision related, I have that anyway, so I can't rely on peripheral vision blurriness as an indicator of hypoglycemia. A headache, that has been one of the more reliable symptoms that I experience of hypoglycemia, just because of the fact that yes, I do get headaches, but a lot of times when I get a headache, in like the front of my head to the middle of my head, that is when it tends to be more reliable as far as hypoglycemia. So, severe symptoms if untreated. Confusion or difficulty concentrating. Definitely the confusion aspect. I haven't really noticed difficulty concentrating because I'm constantly like moving from one activity to the next. I honestly feel like I might have ADHD a little bit because, you know, I don't know, I can't really concentrate on things for the most part on an everyday basis. Slurred speech, I have had that before. Sometimes it's just a sign that I'm going to have a seizure, though. So when I have slurred speech, because I'm not a drinker, so I don't get drunk, things like that, if I have slurred speech, that tends to be an indicator that I either have low blood sugar, like I'm falling low, or it is an indicator that I'm going to have a seizure. So when people around me notice those things, they tend to get a little worried or freaked out because I'm either going to have a seizure or my blood sugar is dropping lower than it needs to be or should be. Coordination problems. People can't use that right now as an indicator of low blood sugar because I don't really have very good coordination just because of all of the health problems going on. So we can't really use that as an indicator. Seizures, we can't really use that as an indicator either because if the Dexcom goes off saying that I'm really low, then yes, we can use that as an indicator. But otherwise, I do have a seizure disorder. I have epilepsy. So we can't really use that as a reliable source unless, like I said, my Dexcom or my finger sticks actually show that my blood sugar is low. And then loss of consciousness, I have not had that happen. As surprising as it is, I've dropped into the 30s and have not lost consciousness. So that is definitely something that is concerning. And again, those are pretty much the only indicators I have of hypoglycemia. I just kind of wanted to go over those, but I just want to reiterate, if you suspect that you have low blood sugar, definitely make sure that you consume sugar, like whether it's a glucose tablet, juice, or candy. And if you have more of these severe symptoms, or if you have symptoms that are worsening, definitely make sure that you get medical attention because it can very quickly move into something bad where you could go into a diabetic coma or something like that. Even if you don't have diabetes, if this is your first time with low blood sugar, there might be a reason. You could have diabetes that is just undiagnosed, or there might be something else going on. So definitely make sure that you seek out medical attention. It is very important that you take care of yourself, and hopefully someone found this helpful. And yeah, like I said, I've dropped into the 30s before and had like literally zero symptoms, so I'm not sure exactly why that is, but I just kind of wanted to share this with you guys. Hopefully, like I said, someone found this helpful. If you have any questions or comments or topics you would like to hear me talk about in the future on this channel, let me know, and I'd be glad to get something filmed for you. And with that being said, I will talk to you guys in my next video.